Hello, everyone. Welcome. Thank you for joining today's webinar, Navigating Ethical Issues in the Care of Older Adults, presented by Home Instead and hosted by the American Society on Aging. Before we begin, there are a few important things I'd like to go over with you. We've made a few updates to how we present continuing education information to stay in step with evolving guidance from our regulatory boards. So not every webinar will offer every type of CE. You'll find the specific CE types available in that webinar's page. Be sure to review those details carefully. If your accrediting board isn't listed, we recommend checking with them directly to see if one of the available CE types will be accepted. After today's webinar, you can apply for your certificate by clicking on the tab above the presentation screen. Please be sure to select your certificate type or board. And if you don't have a license number, you can simply enter NA. For step-by-step instructions, head to the How to Claim Credit tab. You'll also see periodic engagement checkpoints during the webinar. Make sure your pop-up blocker is turned off so that you can respond when prompted. You can find instructions for disabling pop-ups under the Reminders tab. If you run into technical issues, try refreshing your browser first. If that doesn't work, click the Help tab for support. You can download today's presentation slides from the Materials tab, and a recording will be available in your classroom within 48 hours. And finally, we'd love to hear from you, so use the Q&A tab to submit your questions. We'll get to as many as we can at the end of today's presentation. And now I'm so pleased to welcome Dr. Lakeland Eichenberger. Lakeland is a gerontologist and caregiving advocate with Honor and Home Instead, the world's largest provider of home care. She began her career working directly with older adults and now focuses on educating professionals, families, and communities about the challenges older adults face and how to support them with compassion, respect, and the right resources. With a PhD in gerontology from the University of Nebraska, Lakeland brings deep knowledge of aging issues and has spoken nationally and internationally on caregiving, ethics, and the importance of person-centered care. We are thrilled to have her here to help guide us through some of the tough, real-world ethical situations professionals may face and how we can navigate them with confidence and care. Lakeland, thank you so much for being here.
Thank you so much, Victoria. Hi, everyone. It's great to be with you. I know we're in the middle of summer. For many of us, it's very hot where we're at. Here, I'm in Nebraska, so we have a very hot, sunny day. But glad that you're with us. Hopefully, you're in some nice air conditioning and can you really dive in with me on this really important topic. Ethics and ethical issues, they are inevitable, I think, in many professions, but especially when you're working with older adults. There are just a number of factors that make an older adult more vulnerable, make that population more vulnerable, and we're facing these ethical issues each and every day in our roles. And so while some of this might seem like a refresher, I think it's important for all of us to regularly connect with this topic of ethics and remind ourselves of the importance of ethics within our role, how it shows up day to day for us. And with these tools in our toolbox, hopefully we can navigate these ethical issues with a little bit more ease and also help family caregivers navigate ethical issues. Because I think what's can be really challenging is, for us as professionals, we have guidelines, we have policies, rules, regulations that help guide us in our decision making in a lot of cases. Family caregivers, they don't have that. They don't have that playbook that's telling them, yes, this is right, or no, that is wrong. Of course, there are some things that are very black and white, but for many, there's a lot of gray areas. So we can even pass some of this education and information along to the family caregivers and the older adults that we interact with in our roles. So let's go over quickly the objectives that we have. We're going to start with reviewing the ethical principles. We're going to talk about some common ethical issues, and we'll talk about, prevention of things like abuse, neglect, ill intent. We'll talk about supporting older adults in decision making, and hopefully we can do so by, helping them maintain as much independence and dignity as possible. And then I'm going to walk through a few decision-making models at the end to hopefully help you in your role and as you go through some of this ethical decision-making. So, all right, we're going to just jump right in. So let's start by talking about some of the terms. When working with older adults, we know it's so important to treat them with dignity and respect. And acting in an ethical manner really honors the right and dignity of all people. But formally defined, ethics is a system of morals, values, a set of principles of conscientious conduct. It's really doing the right thing to honor someone's decisions. And most of the time, it's easy to do the right things. But you may have issues or situations that arise that create some challenging situations. That's where it gets really tough. And as I mentioned, many professions, like the healthcare profession especially, has codes of conduct. And for many, it's drilled into us during our training. But family caregivers might struggle. And they might not also understand some of the attributes of aging that could make their loved one more vulnerable. So we can help them recognize that and how it might impact some of the decisions that they're making for the loved one that they're caring for. And really ethics boils down to doing the right thing, but there are laws that help to guide these ethics. So when we look here in the United States, as part of the Patient Protection and Affordable Care Act in 2010, the Elder Justice Act was created. It was the first piece of federal legislation passed to authorize a source of funding to address things like elder abuse, neglect, and exploitation. So, of course, it's important for us to know about that. And it really was the first comprehensive piece of legislation to address elder abuse. And it also provides support for the long-term care ombudsman program. And many of you know these programs work to resolve problems related to things like health, safety, welfare, and the rights of individuals that live in long-term care communities, nursing homes, and so forth. And these ombudsmen, they are such passionate advocates and serve a really important role. They help to, protect the older adult, their family, but also help be that liaison with the community. And while laws like this are important, I do want to make sure that we talk about the difference between law and ethics, because law really is the minimum that we must do to protect older adults. And ethics should really be our maximum. And so, we know an ethical person follows the law, but they're also kind of guided by these higher ethical principles. And an ethical person really does the noble and right thing and bases their actions and decision-making on values. And sometimes those exceed what is laid out in the law. So I think that is important to keep in the back of our minds. So again, I mentioned that there are some attributes of advancing age that can make a person more vulnerable. And that's why this topic of ethics becomes more and more important. So let's talk through some of these attributes of advancing age. One thing I love about working in this field is that older adults, they are all so unique. They all have diverse backgrounds. They have different lived experiences, and they've given so much to our society. And while those differences exist, there are some of these common attributes that can increase their vulnerability. So again, it's important for us as professionals to be aware, and we can also help educate family caregivers. So there are a lot listed on the screen. It's not a all-inclusive list. I'm sure those of you out there watching and listening could add to this list. But it's things like isolation and loneliness. It is a huge concern, and it can lead to physical health issues, mental health, and it can make an older adult more vulnerable. We also know that a person's health status and physical decline might increase their need for care and support and their dependence on others. And so when you depend on someone else, it can make you more vulnerable. We know many people, as they get older, they go through a number of personal losses. Maybe it's the loss of a spouse or a friend or other family member, but it could also be the loss of independence, like having to give up their keys and stop driving. And even, a life change like retirement or, a move to a new community can be a time of transition. And actually, the webinar I did last month, we talked about kind of walking through and supporting older adults through difficulty and change and major life transitions. So if you're interested in that topic, be sure to go back and catch that webinar. It's still on demand, still available for CE credit. Cognitive impairment, dementia, Alzheimer's disease, that can put someone at risk for some vulnerabilities. Someone with frontotemporal dementia especially might have poor judgment, could leave them vulnerable to scams and things of that nature. And so it's important to be aware of that. And financial security, socioeconomic status. Those who lack financial security might be more vulnerable. They might not have access to services and supports. Where a person lives, whether it's in their home setting or in a care community institutionalized setting, can also create some vulnerabilities. And what's really unfortunate is older adults are also less likely to report abuse for a number of reasons. And so, that's really hard, because if it is taking place, of course, we want to know about it, we want to address it. But if it's not being reported, then how can we know about it? So teaching families, knowing the signs can definitely help us recognize when it is potentially taking place. So we know that these attributes of advancing age can make an older adult more vulnerable. So that's why it's that much more important that we really kind of steep ourselves in these ethical principles so that we can help the older adults that we work with and help us in a decision-making process. And I did this presentation recently, and somebody said, I would love to print off this slide and put it up on my desk. Feel free to do that. You can download the slides. Just having this visual reminder was important to this aging professional. But before we go through each of the definitions of each of these ethical principles, again, I want to stress that these terms might vary slightly from one profession to another, and it really isn't the term that matters as much as the meaning behind the term. So, the ethical principles that you see here on the slide were introduced by Beauchamp and Childress in the late 70s, and they identified 4 principles that are at the core of ethical reasoning. And then I added the 5th one, fidelity, at the end, and I'll explain why. But let's go through these. So autonomy is the principle that addresses the respect for independence and self-determination. Really, at the essence of this principle, it's allowing the individual the freedom of choice and action. How much do we all value our independence? When it's threatened, we kind of have sometimes a visceral reaction. And so as a person gets older and their abilities decline, they're having to start to depend more on others, or they may be resistant to help because they're trying to cling to their independence, their autonomy. And so as we go through these decision-making processes, how can we help to maintain as much of that independence, that autonomy for the individual as possible, given the circumstance of the ethical scenario that we're facing? Justice seeks the sharing of benefits and burdens based on fairness and equality. I think, as I mentioned, we serve a very diverse population, and so we want to make sure that we are making decisions, ethical decisions, in a consistent way. And not making exceptions for certain individuals or whatnot. That ethical principle of justice should also be at the heart of what we're doing. Beneficence, simply stated, is to do good, to be proactive, and prevent harm when possible. And I think we all get into this industry, or you enjoy, many of us, working with the older adult population because we are able to do good. We're able to help them and support them. And so that, can be rooted in that ethical principle of beneficence. And then we have non-maleficence. It's a little bit of a tongue twister, these terms, but non-maleficence is a concept of not causing harm to others. So it's often explained as, above all, do no harm. And again, I think many of us, we go in with that intention. We don't want to do harm. And I think that family caregivers also go into, their caregiving role not wanting to do harm. And so I think that, again, should guide us as that ethical principle. Okay, so then this fifth ethical principle of fidelity, it depends on your profession, but I thought it was important to add, especially for family caregivers, because it involves the notion of loyalty, faithfulness, and honoring of commitments. And how many times have you worked with a family caregiver who has said something to the effect of, well, my mom raised me, or my aunt raised me, and so the least I can do is care for them now. They have that fidelity to their loved one, that loyalty. Or how many of you have heard a caregiver say, well, I promised mom or dad I would never move them into a nursing home. That loyalty that they feel so deeply. But then they get to a point where maybe their loved one does need more care than they can provide, and a nursing home might be the best option, but they have that internal conflict, that promise that they made. And so again, that notion of fidelity can also show up. So that's why I choose to add it in there. So when we look at these ethical principles, there are a few factors that really kind of drive these ethical principles. So I think it's helpful to kind of talk through how these ethical principles are embedded in our professions, our organizations, or our family cultures. And really, it can be broken down into two categories. We have formal and informal. So the formal dimensions of culture that really kind of shape our ethical principles, these are things like our policies and procedures, our codes of ethics, our value statements, our Bill of Rights for our patients or our clients or our residents. It's also formed in our processes, how we report, our standards reviews. Some professionals even have ethical review boards. But these formal dimensions, they're usually written down, and they're usually planned. And so, of course, those are very important. The informal dimensions of culture, on the other hand, those are more just the norms, how people actually do things, the stories that are told, the observed behaviors, and they're often unwritten, maybe even spontaneous. So it might be that water cooler talk. You might hear somebody say, well, the policy says this, but how we actually do it is, or off the record, this is how things really go down here. It's those kind of informal dimensions of culture. And I think especially in a family caregiving setting, the ethical principles are going to be driven more by those informal dimensions. But many families, they're caring for the first time for a loved one. They've not really observed anyone else doing this role. And so they're kind of learning as they go. So I think that is something to keep in mind. So you might want to pause for a moment and think, maybe within your profession, your organization, or maybe you're personally going through caregiving, what's driving your ethical principles? Is it these formal dimensions of culture, this informal? Likely it's a mix of both. But I did want to share one example of a formal dimension of culture. It would be a Bill of Rights. In a hospital setting or a care community setting, there is usually a patient Bill of Rights that again drives a lot of kind of the ethical principles within that organization. So you can see here, everyone has the right to considerate and respectful treatment. They have the right to design their treatment plan or service plan. They have the right to refuse treatment. They have the right to privacy, to file a complaint. So again, these are those more formal elements of ethics that can show up in the culture of an organization. So now let's talk through some of these common ethical issues that we might be facing in our roles. And again, this is not a comprehensive list. Again, I'm sure you could probably add to this, but a lot of times when we're working with older adults, the ethical principle of autonomy kind of shows up again and again. I think, as we go through our life, we take advantage of our independence and autonomy, our right to make our own decisions. And as we grow older, we want to maintain that right. We want to hang on to that. We don't want others to make decisions for us. We still want the ability to speak what's important to us, to have privacy, to open our own mail, to vote, to have our medical records kept private, have a say in our plan of care for our diagnosis, to have control over where we live, the type of care we're receiving. If we have to make a move, we want to have a say. So if there's ever, again, a threat to that autonomy, then you might start to see some of that resistance. And so I think that again is important as we go into some of these ethical issues that commonly occur, to just keep that in mind. So again, this is not a comprehensive list. I will, in the following slides, go a little bit deeper into some of these. So I'll just skim on a few of them here on this slide. First, ageism. We know that ageism can show up in a variety of environments, sometimes even in our healthcare system. Maybe a provider suggests less aggressive treatment for an older adult just based on their age without ever really asking the patient what their opinion or what they want out of their plan of care. Maybe it shows up in other ways. Maybe it's assumed that because the individual turned 90 that they're no longer fit to drive, even though you haven't assessed their driving ability. And so I think it's important when we consider these ethical issues, we can't look at it through the lens of age. We really need to focus on the person's abilities, their capabilities, their wants, wishes, desires. Have to take that all into account. We can't just look at it through the lens of age, which lends itself to the bias and discrimination. We know that also can show up in ethical decision makings. Sometimes it shows up in racial discrimination, sexual orientation, gender, and we might, see in a senior living congregate setting, somebody who maybe doesn't identify as male or female, they might experience some bias and discrimination. And so that could be an ethical issue that arrives that the community staff has to work through. Personal privacy. I mentioned already that, privacy is important. We want to make sure that we're respecting that privacy. Are we knocking before we enter a room? Whether you're a family caregiver in the home or maybe housekeeping in a community care setting. We want to maintain as much privacy for that individual as possible. And then another example, again, not able to hit on all of these, but grievances and complaints. Is there an outlet for an older adult to express those? I think sometimes, in a family caregiving setting, that might be more challenging. Who would they complain to, or who would they raise those concerns to? But in a more formalized care setting, there should be an outlet. That ombudsman is a great example of someone that families can reach out to. And the community should also have, a comments box or a hotline they can call. I know at Home Instead we have a national ombudsman as well, a team that really works to address any issues that are raised by whether it's our clients or the care professionals or people that work within the offices of our locations. And so it's important to have those outlets for people to share. Another ethical issue that comes up a lot is capacity and competency. And there's often confusion between the two terms. I continue to sometimes be confused by them, but the capacity is the ability to make decisions. It really is a fluid concept. A person might have capacity in one moment, but lack it in another moment. And competency is the ability to perform the actions needed to put a decision into effect. So competency is more of a legal finding. And so, again, it is kind of challenging to wrap your mind around it. But sometimes people just assume, and maybe a family caregiver might assume, that it's just an all or nothing type of ability. You either have it or you don't. And sometimes a person might have capacity in some situations or for some decisions, but they might lack capacity or competency in another type of situation. So, it's important that the individual understands, what situation that they're in, the decision that is in question, the consequences of making a decision or a given choice. And again, somebody might have capacity in one moment or for one type of decision, but not necessarily another. So for example, if an older adult is, in surgery and they're kind of coming off of their anesthesia, they're drowsy, they're probably not, they might not have the capacity in that moment to make a decision, but fast forward a few hours or to the next day, and then they have, resumed their capacity. The fog of the anesthesia has lifted, and they're able to make decisions for themselves. When we talk about cognitive impairment, that's, adding an additional layer of complexity. And, someone living with cognitive impairment, they might be able to make a decision on, some of their activities of daily living, but they might not be able to make the decision for themselves on a financial matter or in terms of their ability to drive or not drive. So again, a lot of complexity to this ethical issue. That's where an elder law attorney, a professional in this space, can be very helpful and can be a great resource. I think for many of us that work in this space, confidentiality and professional boundaries can become an ethical issue. Most of us in our professions have an obligation to confidentiality, and this ethical kind of principle of autonomy requires that. There's also laws in place that protect confidentiality, like HIPAA laws, PHI, private health information, very kind of strict guidelines around those types of things. However, the only time really it's acceptable to break confidentiality is in a situation where we are a mandatory reporter of something like abuse or neglect or impaired decision-making capacity. And so it's important, of course, that we are friendly and cordial, and we build a relationship with those that we work with. I think, again, that's why so many of us got into this field. We have the heart to care and serve and come alongside others in their journey, whether it's their aging journey or their caregiving journey. But it is important to maintain those professional boundaries. I remember back when a friend of mine, her father was going through cancer treatment, and one of our friends was his nurse. But the family, they didn't want to share his diagnosis. They did not want to make it public. And so it wasn't until his funeral when our friend who was the nurse came, and we were all a little surprised. And she said, well, I cared for him The family then, shared that she cared for him, and we had no idea. So she very much so upheld her, duty, her ethical principles around this notion of confidentiality. And so, again, in our profession, it's easy to become like family in some situations, but we do have to kind of maintain those professional boundaries. Of course, elder abuse and neglect are extremely important ethical issues to cover. I do think that these issues get covered maybe more so than some of the other ethical issues that we've been going through this presentation. So I really only have one slide on each. But we know that there are various types of elder abuse. I don't mean to downplay this by any means, and I want to make sure that we're continuing to educate ourselves on physical abuse, sexual abuse, emotional and psychological abuse, financial abuse, and neglect that impacts the aging population. I think the financial abuse, we see that a lot talked about in the media. Scams. Oh my goodness, scammers are getting more and more sophisticated. That's actually the topic for next month's webinar. So I will dive a lot deeper into that topic. And it's devastating what it does to an older adult in the family from a psychological perspective as well. But I think sometimes we don't talk as much about physical abuse of older adults or even sexual abuse of older adults. And so it is important to educate ourselves on these issues. And I think one area of neglect, so there's also different types of neglect. One area that can become a really, really tough ethical issue is self-neglect. When somebody kind of has a failure to thrive, or they're not meeting their own essential physical, sociological, and social needs. And so what do you do in those types of situations? How do you help somebody that seemingly doesn't want help or doesn't have maybe the will or drive to better their situation? So that can be really, really challenging. And, when we think about neglect, of course, the physical neglect, emotional abandonment, financial neglect. I listened to an interesting podcast about family caregivers and how, sometimes the lack of support that they feel that they have or that they have access to can unintentionally lend itself to neglect. Does not make it right. But I think that it's important to consider, if we're seeing neglect in the work that we're doing, do family caregivers know about services and options that could help them in their role so that they aren't unintentionally neglecting their loved one? And again, we know some people do intentionally, unfortunately, neglect. But I think, when we're looking at it from an ethical perspective, we need to really understand the scope of the situation. And we'll talk about that in the ethical decision-making models. We really need to understand the whole picture and come alongside families and help provide supports where we see it can be beneficial. Of course, as mandatory reporters, it's important to remind ourselves when we do need to report, call 911, call Adult Protective Services. This checklist from the National Adult Protective Services Association, is just a great reminder to us all. I'm not going to go through it word by word, but again, just good to refresh our memory regularly on when it's important to report these types of things. And then it's also important, of course, to focus on prevention of elder abuse. So again, becoming aware of the risks, learning the signs to look for, preventing isolation and loneliness, that can help reduce a person's risk. Providing respite for family caregivers, a break so that they don't hit kind of that burnout point, and again, lead to potential abuse, educate on fraud prevention, and of course, report abuse and raise awareness amongst our organizations or our professions or wherever it is that we work. And last month on June 15th, it was World Elder Abuse Awareness Day. So if you didn't take advantage of kind of that day of education, maybe you plan ahead for next year and create maybe a social media campaign or put together a presentation in your local community for education on this topic. The next ethical issue that could arise centers around supporting care decisions. And this often happens a lot towards kind of end of life or amongst those that are faced with a medical diagnosis and a complicated treatment plan. But, these end of life decisions, again, lean into that autonomy, that principle of autonomy, and allows for the person to participate in decision making as much as they're able. So it's important to respect the person's choices for their ongoing care or their discontinuing of treatment. If they decide not to pursue treatment for a specific diagnosis, supporting their life-sustaining interventions and having a conversation, understanding what their wishes are around that, or their do not resuscitate orders, and again, those end-of-life decisions. And then, if they want to donate their body to science or research after they pass away, honoring that choice as well. And then there's this concept of dignity of risk. It's something that I have become more and more curious about in the last 6 months or so. And I added a slide on this topic specifically because I think sometimes it's hard to really balance that autonomy and safety in the support of the decisions that our loved ones are making or the clients that we serve are making. And so the dignity of risk refers to the right of an older adult or anyone really to make a choice that involves prudent risk. Maybe it's living independently, managing their own medications, engaging in maybe what seems like a challenging activity, even if those choices could lead to potential harm. If you think about it, over our lifetime, we are constantly taking risks. Every day, we're calculating in our brains the risk of making this choice over that choice. And some of it kind of we do almost without realizing it. And then some are bigger life decisions or bigger moments where we're analyzing risk. But life is about learning from our mistakes and failures. It's a part of life and it's a part of how we grow. And I'm sure if you talk to any of the older individuals that you work with, they could tell you about a time in their life when they failed, but they learned and they grew from it. And so this concept of dignity of risk, it kind of started in the disability community, developed by Robert Persky in the 70s. But, in the recent years, I've seen more talked about in terms of aging adults and how do we balance that autonomy with their safety. And really, dignity of risk, it matters because it respects a person's autonomy, it supports self-determination, their personal freedom, and also can support well-being. And you do really have to take a very person-centered approach to this concept. Everyone's situation is different. Everyone's capabilities are different. I recently did a podcast episode. I have a podcast called Caregiver Chats, and I talked to Adria Thompson. She's an occupational therapist and dementia care expert. And we talked about this topic because, again, I've become very interested in learning how this plays out, not only in a professional setting, like a care community, but also in a family caregiver setting. And in this podcast, Adria and I talked about how, in a care community, for example, a more professional setting, professional care setting, you have those policies, those rules, those procedures that you follow to help kind of minimize the risk or kind of help maybe employees go through that process of balancing the safety and independence of their residents or clients or whatnot. But on the family caregiver side, you don't have those things. And Adria talked about how usually family caregivers are trying to simultaneously balance three things when it comes to this kind of concept of dignity of risk. She said they're trying to balance independence with safety. And then the third is like comfort or joy. So at any one time, a family caregiver is trying to assess, okay, if I let my loved one do this, are they going to be safe? But is it going to bring them joy? Or is this going to allow them to be independent? And it's really hard to make all three of those things equal in every single care decision. We talked especially in someone living with cognitive impairment. Maybe at the beginning of their journey with cognitive impairment, you do want to prioritize independence. Try to let them do as much as they can for as long as they can. And then, maybe in the more middle stage, there's more concern around safety. We want to make sure that they're safe in whatever that they're doing. And then maybe when they enter more of the end stage of cognitive decline, maybe it is more focused on that comfort and joy, whatever is going to make them feel good. They're not able to do much, so we're going to prioritize that comfort or joy. And sometimes it differs from moment to moment, decision to decision, and that can be just really hard for a family caregiver to juggle, because if something does go wrong, when we make a poor decision for ourselves, we just have to kind of live with it. But if we feel like, we let my loved one do that and something bad happened, there's a lot of guilt associated with that decision. So, as you're thinking through decision making, you can think through questions like, how risky is this situation? How significant is the potential impact for the person or for others? So you want to thoroughly assess the risk, encourage decision making, involve the older adult as much as possible, and provide support. Try not to overly control, and respect their right to fail. If the person if the person does not have cognitive impairment, if they are of sound mind and they want to make a decision, in some situations, it might be that you have to let them fail. And I think if you've done your due diligence of going through the process, ethical decision-making process, analyzing, making sure that you've expressed, well, I know you want to do this, but I would not recommend it. Sometimes it is that failure that will lead to maybe next steps that need to take place. And that's a really, really, really hard thing to come to terms with. I think as professionals, that's where one of the most gray areas that we face in a lot of situations, and same for family caregivers. So again, I encourage you to go listen to that episode. It was really, really good. You can find caregiver chats on your favorite podcasting app. I have a slide towards the end with a reminder for the podcast, but it was a really interesting conversation. And I think, sometimes I hear this talked about a lot in the falls discussion. How much independence do we let the individual have? They won't use their walker or their cane. Or a family caregiver might just say, well, I'm just going to let them fall, and then we'll finally get them to make a decision or realize that there's a problem. And so, again, this is a really gray area. And sorry to spend so much time on it, but I've been just really interested in the topic. But the last kind of ethical consideration area of potential vulnerability, ethical issue that can arise centers around dementia, cognitive decline. And of course, people living with dementia, we know that they are still a person living with a disease. And so we want to help maintain as much of that independence and autonomy and personhood as we can. That's why person-centered care is so important, because everyone is on a different dementia journey. Their capabilities, their abilities vary from person to person throughout their journey. And so it is important to evaluate, what is their capacity for decision making. Of course, we want to balance that autonomy with beneficence. We want to do good. We don't want to do harm to the individual. So, can they make a reasonable and informed decision? Will it cause harm to their self or others? Can a person that's making this decision, can they understand the risks and the benefits? And is there consistency over time? I think that is a helpful question, especially if you have been able to have conversations with the individual from, the maybe beginning of their diagnosis onward. Maybe from the very beginning, they have always said, well, if I do have to make a move to a community, I want to go to this place. And if they've consistently said that over time, then that can help with that decision making. Or if they've consistently said throughout their lifetime, I never want to be on a ventilator, never do that to me, that kind of a thing, then again, there's that consistency over time. So that's why having those discussions early in the diagnosis is so important. I also think it's really important to reinforce that we don't want to ignore the person's capabilities. I think sometimes it's very easy to jump in to make decisions for an individual, but we want to help them maintain as much of that independence and autonomy as possible for as long as possible. And again, making a move to a facility or a new environment can create some vulnerability, and it can be challenging to know the best way to do that. I just watched recently a really wonderful film called Familiar Touch. And in the movie, it's not a documentary. It is, a film, but it depicts a woman's journey of moving from her home into a memory care community. And, you see the turmoil of the son, and, how hard it was for him to move her into the community. But he reminded her, Mom, we've had these conversations. This is what you wanted when we got to this point, but didn't make it any easier. So these are a lot of ethical issues. And again, I know I painted a broad stroke, and I'm sure all of you are thinking of ethical decisions that you could add to this list. But let's move now into some of these models that you could use to help you through this decision making. And again, this might seem a little basic, but when you're in the thick of it, it can be helpful to go back to a slide like this, step by step, to help you walk through. So the first step is understanding the dilemma. And this ethical decision-making model in particular was developed by Dr. Cratcher at the Business Ethics Alliance, based out of Creighton University. And so anyway, the first step is understand the dilemma. So first, what is the ethical issue? What are the conflicting ethical values that I'm feeling? Also, what are the facts of the situation? I think it's so easy to get caught up sometimes in the emotion. Let's ground ourselves in the facts of the situation. And then who are the stakeholders? Who is everyone involved in the situation or affected by the situation? So once you've understood the dilemma, then you want to go to step 2, imagine the options. So at first glance, what seems to be the black and white obvious solutions? And in some cases, there might be some. In other cases, you might be in that really gray area and you think, oh gosh, there's no black or white for me in this situation. Then think through what are some of the outside of the box solutions that you can think of. Then you move to step 3, where you think through the options, and you think far, you think wide, and you think high. So first is to think far. What is in it for me or for us? What option produces the greatest good for everyone involved, all of those stakeholders that you identified. Then think wide. What do legal, professional, organizational, human rights, duties, and responsibilities require? So that's checking in with those more formal elements of ethics, any of your policies, procedures that you have within maybe your profession or your care setting. And then also think, what is fair? Has something like this come up before? How has it been handled? And then think high. What are the aspirations of the people involved or the organization involved? Maybe, for the family caregiver, it might be okay. In this situation, are we going to preference independence, safety, or that comfort? And then, when you're thinking high, which of the options would people most respect or be proud of? And are there any options that would be embarrassing or paint you or your organization in a bad light? So after you thought far, wide, and high, then you decide on what is the right thing to do and why. And so I know that all sounds easy, but it does take a lot of thought. There is another ethical decision-making model that was developed by Forrest Miller and Davis. And this can also be helpful sometimes to see a second model. In this one, you identify the problem, apply your code of ethics if you have one, determine the nature and dimension of the dilemma, generate your possible course of action, consider the potential consequences of all options, and determine a course of action, evaluate the selected course of action, and then implement. And in the evaluate stage, what I liked about this ethical model is it said, apply 3 simple tests to ensure that this is an appropriate course of action. First is justice. Would I treat others the same in this situation? Publicity. Would I want this behavior reported in the press? So if you had to go to a reporter and tell them the decision that you made, would you feel good about it? And third is universality. Could I recommend the same course of action to another person in the same situation? Sometimes going through kind of those little checks in your head can be helpful as you work through these ethical decisions that you're making. So again, maybe it's helpful to print off a couple of these slides and have them handy to pull out when you're going through some of these big decisions. And I'm running low on time. I always do this to myself. I talk way too much, so I am so sorry. But I did put together some practice scenarios. So perhaps you want to, again, refer to this slide later. There's just 3 different scenarios. Maybe you want to get another coworker to talk through this with you or do it as a team activity. Or maybe you bring, 3 of your own actual real life dilemmas that you're facing or have faced and talk through those scenarios. That could be a great kind of takeaway or next step after this presentation. Or maybe if you're kind of solo, you can think through a recent ethical dilemma and kind of evaluate, how did I handle that? Is there anything I would have done different? So that maybe next time you're able to, apply the model and work through any future decision that you have to make or ethical dilemma that you have to navigate. Just to wrap up, some final tips for professionals, and then next I'll touch on caregivers. If you haven't already, inquire about your organization's ethical practices and review your code of conduct regularly. Refresh on your Bill of Rights if you have that. Stay up to date, of course, on local and national laws and regulations that impact your profession or industry. And then engage in these ethical decision-making models and, of course, report any abuse or neglect. And then for family caregivers, encourage them to learn about the signs of abuse. Educate them on this fraud prevention. Encourage them to plan ahead, not just talk about the short-term care decisions and needs, but also the long-term, and maybe even document some of their wishes. Maybe it's a voice recording or some sort of official document. Of course, lining up advanced directives are going to be important. That way you can refer back to them, and they kind of can be used as a guiding light in some of these ethical dilemmas. Getting those important documents in place, you might need to consult a professional, an elder law attorney, to help with some of those documents. But I think what's important to remember, those 4 ethical principles, those 4 plus the 5th of fidelity that I added, those ethical principles really should be at the heart of what we do, guiding us. Because when we do get it right, it really makes all the difference. We can support a person's autonomy and their decision making. We can seek justice for those in our care. We can do good on behalf of the individual and protect them from harm, and really show our faithfulness and loyalty, and really honor our commitment to provide care and support for those that we serve. So again, these ethical concepts really should be our guiding light, and we can use the tools in our toolbox along our journey as well. And so I'll leave up this recommended resource slide, and then Victoria, I know I only left us about 4 minutes for questions. I'm so sorry, but we can take a couple questions, and I'll just leave the resource slide up here. Again, you can download the presentation and access all those resources.
Okay. Thank you so much, Lakeland. I always say the content is the most important things, and we can try to get to these other questions later on in some other form, or you can always contact Lakeland. She has her contact info on the slides. But we received so many excellent questions, and since we don't have that much time, I'd like to focus on one that really speaks to the core of today's discussion. How should professionals respond when an older adult is making decisions that seem risky or unsafe, like refusing help, continuing harmful routines, or showing signs of cognitive decline, but there's no formal diagnosis or no family support? When does it make sense to contact APS, and are there other ways we can support the person while still respecting their independence?
Ooh, that's a big question. I feel
know.
like there's a lot of sub questions in there. I think that's a really challenging situation, and very much a reality in a number of scenarios. So very grateful for all the questions that have come in. I think there was that checklist on slide, trying to remind myself, 16 on when to report. So I would go, refresh yourself. The Adult Protective Services Association, they have some great resources on their website. So I would refresh yourself on their recommendations on when to report to APS. I think in situations where a person is being very resistant, it's important to really seek to understand. Are you really taking the time to listen to the individual, to ask really good questions about why they're resistant to care, what they're hesitant about? I think sometimes, perhaps not in every situation, maybe we lack the time or haven't given enough time to do kind of a bit of a discovery process, really get to understand, okay, what are the needs of the individual? Why are they being resistant? Do they understand the risks and the consequences potentially of the decisions that they're making? Again, if they are of sound mind, I think to some degree you do have to respect their decisions that they're making, but making sure that they have all the information they need to make the best decision possible. In terms of cognitive decline, if you're seeing signs of that, and that's kind of bleeding into some of these ethical decisions, it's really important to be documenting those instances and to present them to that person's healthcare provider. Sometimes, you might have to reach out to the doctor and give that information. because of HIPAA laws, the doctor might not be able to communicate back with you, but you can always share concerns that you are noticing or witnessing with that healthcare provider. And in a lot of cases, it's not a one and done conversation. In some of these instances, it requires kind of building a rapport with the individual, building some trust with them, really showing them that you're there to listen to them. You want to understand what's important to them. And your goal is to help them maybe maintain as much autonomy or as much independence as possible. And then present the options and help them kind of weigh the options. And sometimes it's a little bit of a negotiation process depending on the person. Maybe it's agreeing to try a service for 30 days. And then after the 30 days, reevaluate. That way a person doesn't feel like they're locked into anything for an indefinite amount of time. So again, it's so hard to answer that question because every situation is so unique and different. But hopefully there was a few little takeaways that could be helpful in that situation. And again, I think we all want to be heard. We all want our wishes to be known and understood, and that just doesn't go away because we're aging. So I would start there.
Thank you. I know that was a lot, but I think it covered a lot of those key questions. Thank you so much, Lakeland, and thank you all for joining today's discussion. We hope that you found it valuable. Again, thank you, Lakeland, for sharing your expertise and your insights and your strategies, and to Home Instead for making the session possible. If you'd like to revisit today's content, the recording will be available in your classroom within 48 hours, along with the slides. If you're looking for more learning opportunities, don't miss out on our On Aging Rewind sessions, available this month only. These are standout presentations from our annual conference and are open to everyone. You don't need to be an ASA member to attend these live sessions. You can also look up upcoming webinars on our website, asaging.org/webinars. You can also explore our On Aging Institute courses on topics like ageism, AI, digital literacy, and finance. And you can also take advantage of our current offer right now for a trial membership starting at $25. So thank you so much again. If you have any questions or feedback, any questions for Lakeland, she has her email there, but you can also send us emails at institute@asaging.org. A few of you asked about the podcast. You can search Caregiver Chats wherever you listen to your podcast. They're a great resource. Thank you again for being with us today. Take care, and we look forward to connecting with you again soon. Have a great day, everyone.